In good health, it's a cosmetic surgery countless women consider each year. But a local woman has a message she wishes she had heard before she underwent the knife. Our local 4 Dr. Frank McGeorge has her story.
Breast enlargement surgery is one of the most common cosmetic surgeries performed in America. And even though complications are rare, they do occur, and they can be devastating to a woman's self-image.
Oh, it's so quick. And you can have a new body by summer, have a total rejuvenation of your life. It's not like that.
At 19 years old, Leanne Stark wanted bigger breasts and went to a plastic surgeon to get them.
They were having a summer special or whatever special they were having, so I paid $3,700.
That was in December of 2001. She immediately noticed problems.
I noticed the first time that I had a problem with it was I was at the mall and I was shopping, and the right side of my chest got really red and it was really hot.
She had developed a bacterial infection, a serious problem.
They told me that I can come back in a couple months later and they would fix it, and then after the 3 months, I just started having complication after complication.
Leanne also developed the most common complication of the surgery, capsular contractions around the implants. Essentially, the tissue around the implant becomes hard, squeezing the implant.
And they would go in week after week and just scrape out all the scar tissue that had accumulated around the implant. It just got to the point where after 4 years, I had had 14, 15 different surgeries.
All the surgeries have left more than physical scars.
Every time I get to the point in a relationship when you're gonna move forward, I have to kind of stop and explain my situation and like what to expect.
Now 26, Leanne is going in for one more surgery. This time, it's to fix the damage from years of painful complications.
When she came to see me several weeks ago, she basically came to ask me if she could help her basically salvage her breasts.
Beaumont plastic surgeon Dr. Anthony Youn did not perform Leanne's previous surgeries. He cautions breast augmentation is serious and can have real complications.
In my practice, capsular contracture, that hardening, probably happens about anywhere from 2 to 3% of the time. Infections are extremely rare. In my practice, once again, maybe less than 1%.
Leanne's case is extreme.
I have never seen a patient who has had 7 or 8 breast surgeries, much less over a dozen. So this is very, very uncommon.
Dr. Youn says it's important for patients to do their homework before seeing a surgeon. Leanne's case is so complicated, Dr. Youn is working with Dr. Michael Shendon, the chief of plastic surgery at Troy Beaumont Hospital.
You ready?
All set.
Ready to make me gorgeous?
Leanne's surgery is even more difficult than expected. The prior surgeries did more damage than Drs. Youn and Shendon thought. But after hours in the operating room, she's on the way to recovery. There's a 19-year-old watching this right now. What would you tell her?
Do your research.
There's an easy way to check up on your surgeon. Ask if your surgeon is affiliated with a hospital you trust. If that hospital allows them to perform the surgery you're having, that means their qualifications have been verified. You should also find out if your surgeon is board certified. To learn more, go to the health page of our website. Click on Detroit.com. I'm Dr. Frank McGeorge. That's Good Health. Back to you.
Now, even after all she's been through, Leanne isn't done yet. In fact, Dr. Youn says she will need more touch-up surgery in the future to repair the damage.